Hi, my name is Elisha. I'm a senior student at Seattle Central's Dental Hygiene program, and I'm here today to talk to you about oral hygiene and long-term care facilities. So today we're going to talk about the importance of oral hygiene as well as some practical clinical strategies that you can employ, specifically as an RN. So a little background about myself. I've worked as a dental assistant for several years, and my long-term goal is to actually work in a mobile practice serving residents in long-term care facilities. So this is a topic I'm passionate about. I've had several family and friends who were actually in long-term care facilities themselves. So to start our presentation, let's begin with a question. What can you do with $5 in 5 minutes? Well, you might be thinking of buying something on Amazon you don't need, or maybe getting an expensive coffee, maybe a cheap lunch. But we're going to talk about something else you can do with $5 in 5 minutes, something that's so important it could actually save a life. So why is oral hygiene care so vital? We all know that we're supposed to brush and floss, and we have dental professionals who focus on oral care. So why is it important for RNs to look into oral hygiene? Well, the answer is that there's an oral systemic link. This is just one example on the screen here of an oral bacteria, specifically S. mutans, which we typically associate with tooth decay and oral disease, that was actually found in cardiac valve samples. And another interesting finding of this systematic review is that gingivitis, periodontitis, and caries, which are oral diseases, actually correlate with some of these systemic diseases. So we can see a correlation with heart disease. This is another systematic review that actually showed how chlorhexidine rinses, so this is an oral antimicrobial rinse, could actually reduce pneumonia rates. In fact, it was so effective at doing this that it decreased patients' need of systemic IV antibiotics, and it shortened the duration of mechanical ventilation in the ICU. So we can see not only is there a correlation between oral disease and systemic disease, but we can actually see that oral hygiene treatments can actually have a measurable impact on systemic disease. So to focus on one specific example that you're no doubt familiar with, we'll talk about nosocomial or hospital-acquired pneumonia. So this is responsible for 10% of ICU infections and 13 to 48% of all nursing home infections. It's considered the most common infection in the hospital setting. So this is clearly something that's prevalent, something that you'll see in practice, but it also has a patient impact. It can easily double the length of a hospital stay, and ventilator-associated pneumonia, or VAP, can cost over $40,000 in treatment per patient. So you can see there's a financial burden here as well. And finally, the real impact is that there's a 25% mortality rate from VAP. So we can see, especially in the context of our current pandemic, we're all familiar with how ventilators have been used. We can see that the prognosis here is not good, something that we want to prevent. So what is the connection between nosocomial pneumonia and oral hygiene? Well, systematic literature review revealed that interventions improving oral hygiene actually had a significant effect on preventing nosocomial pneumonia. So you can see up to 40% of nosocomial pneumonia cases are preventable if some of these basic oral hygiene prevention services are put in place. So these are things like mechanical removal of plaque, as well as topical disinfection using something like a chlorhexidine rinse. So that's 40% of these pneumonia cases that are preventable. But the real cost here is shown by this statistic. 1 in 10 cases of death from pneumonia in elderly nursing home residents could be prevented by improving oral hygiene. So this was found by systematic review in 2008. And really, this is significant. Remember that pneumonia accounts for up to 48% of all of the infections that we're going to see in long-term care facilities. So 1 in 10 is a very significant number. Just imagine something as simple as oral hygiene could literally mean the difference between life and death for these patients. And this could be someone maybe a close friend or family member. We've all had people that we know who've gone into long-term care facilities. So clearly, this is something that's important. So the bottom line is that the mouth is connected to the rest of the body. This seems silly, we all know that this is true, but sometimes we treat them like they're separate, especially treating dentistry and medicine as kind of separate disciplines. In reality, we know that we can't ignore oral hygiene if we want to promote systemic health. In fact, the mouth is one of the key ports of entry for disease. All right, so we've seen why oral hygiene is important in a medical setting. Now let's talk about practical clinical interventions. What can you do to help maintain good oral hygiene for patients? Well, the answer is to set up an effective oral care program. Now, what does that look like? Well, there's 3 specific points that the literature has supported that have made oral care programs effective. So we want them to be patient-specific, consistent, and documented. We'll talk about why each of these is important. So let's take that first point, patient-specific oral care. So before we talk about what we should do, let's talk about what we shouldn't do. You can see on the right here we have an oral foam swab stick. These are really commonly used in care facilities, especially long-term care. Oftentimes CNAs will use these to provide oral hygiene care to a patient. However, many studies have shown that these are ineffective. In fact, a systematic review going all the way back to 2003 established that these were not achieving the oral hygiene that we would want for a patient. So what we do want to do is use the same aids that we are able to take advantage of for ourselves at home. So these are things like a toothbrush, floss, and an antimicrobial rinse like chlorhexidine. So in order to adapt to the patient's needs, we first have to assess the patient's limitations. We have a variety of patients in long-term care facility. Some people are going to be completely independent. However, others are going to have challenges that would require additional help. For example, if someone has limited dexterity, there are varying degrees of dexterity. If they only have partially limited dexterity, then we're going to want to introduce them to some dexterity aids. And let's take a look at what those look like. So you can see here, this is specifically designed for someone with arthritis, someone who has difficulty gripping the thin handle of a toothbrush. We can see something as cheap as a pool noodle, or even just a tennis ball here, or on the right, we see a handlebar grip from a bicycle. These are all very affordable aids that would allow a patient to be independent in their oral hygiene care. Someone who has only partially limited dexterity. Similarly, we see this flossing aid here. The floss is threaded around this loop, and then it kind of goes through the slingshot. And the important part is that it gives them a nice wide handle. So someone with limited dexterity would be able to be more stable and be able to do a better job flossing. So that's someone who has partially limited dexterity. What about someone with severely limited dexterity? Maybe someone with Alzheimer's or advanced dementia who needs direct care. Well, in this case, we're going to want to set up a clinician-to-patient care schedule. And so we'll talk more about what that means on the next slide. But some important things to look for when we're assessing a patient are signs that their current oral hygiene routine is not enough. So if you notice halitosis, bad breath, perhaps they're not brushing their tongue well enough. Maybe you want to check in their mouth to see if there's areas of plaque that they're missing. If you notice that a patient has dry mouth, offering them a saliva substitute like Biotene could make a really big difference, not only in their comfort, but also potentially in preventing oral disease. This is going to be especially effective if it's used with a fluoride toothpaste. Fluoride can help prevent decay. Now, it's going to be especially important for our senior patients who are especially susceptible. A lot of times when patients are taking multiple medications, this will also contribute to dry mouth. So all of this is part of having patient-specific oral care. We're not just using a cookie cutter oral swab stick, but rather we're adapting the oral care routine to each patient. So now let's see how that works for someone with severely limited dexterity. In this case, we're going to watch a video about how to help someone with dementia to brush their teeth. And notice the specific strategies that this clinician uses.
So here's a meal. So you right-handed or left-handed? Right-handed. Okay, so turn this way a little bit so everybody's going to be able to see us. Now, before I had you do hand under hand, right? Now what you're going to learn how to do is be the fine motor when they're losing it. The tool manipulation. So the reason I want her hand is her brain remembers her hand coming to her mouth. The reason I need my hand is she doesn't know how to manipulate a toothbrush anymore. So what I'm going to do is do the toothbrush. She is with me, and by being over here to the side, guess what? She literally thinks what? She's brushing her own teeth. Notice that I have my hand on her shoulder applying downward pressure. I'm tricking her mouth into not paying as much attention. Now you notice Emilie's a little bit tender around here. She's not real fond of this. But let me take away the hand and watch what happens. Much more intense because I'm actually tricking her brain. This is close and it's proximal, and so I'm actually tricking her brain into paying attention to the pressure on her shoulder. Now watch this. So does it make a difference? Yeah, so I want each of you, and here's the deal. If you're going to be really good at this, you have to master both sides because you will have residents who are opposite dominance of you. And it doesn't matter what your dominance is. You have to use their dominance unless they've had a stroke, and you may have to use the remaining side. The reason you want their dominant side, that's where all the brain history is for fine motor tasks. Only one half of your brain has learned fine motor skills. The motor memories are not available on the other side. And so I've got to be on this side. It's also where it's going to draw her eye. Search and rescue will always tell you if the right person is right-handed, they'll make right-hand turns. If they're left-handed, they make more left-hand turns. It's an automatic behavior of the brain. So she will look at me more and pay better attention if I'm on her dominant side. So with your partner, give it a try. Try it out.
All right, so we can see. All right, so going back into it here. So we talked about patient-specific care, how to adapt to patients' needs. Now let's talk about consistent oral care. Oral hygiene care is only going to be effective if we're doing it on a daily basis. So it's very important that we have a system in place to make sure that every resident is getting reached. So in addition to doing this on a regular basis, we also want to make sure that there's a consistent quality between different clinicians. So what we're going to want to do is calibrate our staff. It might be a good idea to have a training session where you use a disclosing agent. It's like a mouth rinse that can help you to visualize the plaque, and then have one clinician brush another's teeth. This would be a program that could help you to ensure that the residents are all receiving consistent care. So we're also going to want to schedule oral care activities for a specific shift and time of day. This is just going to ensure that it's done on a routine basis. So the next point is documentation. So while many nurses report regular patient oral hygiene care, it's rarely documented, according to one study. In fact, studies have shown that sufficient oral hygiene care is frequently lacking in medical settings. So the importance of documentation is establishing why this is happening can help us to identify strategies to improve. So if you offer assistance and a resident refuses, you can document this as well. It might be that there's a certain time of day or a certain provider that patient is not meshing with well. So the bottom line is, if it isn't documented, it didn't happen. It's very important that we keep accurate records. So it's important to be specific and accountable. We know that we should enter the records in the medical chart. However, as an RN, you're likely to be the shift supervisor with CNAs actually providing the direct care. So if that is your situation, you might also benefit from keeping a central log like you see on the right here. Now, the advantage of this is you're going to be able to see every patient that you're responsible for in one place, as well as a record of if they've been offered oral hygiene care and whether that care was actually delivered. So if a resident refuses care or if a CNA forgets to offer care, that's all going to be visible. And most importantly, this record is going to create accountability, not only for the clinician who's providing the care services directly, but also for the supervising clinician. Now, accountability is going to ensure that these patients are actually receiving the oral hygiene care that they need. All right, so what are the benefits of implementing an oral care program? Well, it really can make a difference. In fact, an RN-led program reduced pneumonia across the VA. This is just one article talking about the benefits of that. It was saying by spending just $3 to $5 and less than 5 additional minutes per patient to provide these services, just basic oral hygiene prevention, they were able to prevent 236 cases of hospital-acquired pneumonia and saved an estimated 42 veteran lives. You can see that's a really big human impact there. In addition, there was also financial savings. Since each of these cases would have cost $40,000 a patient, we can also see that there was a $9.4 million savings just from this pilot study alone. So we can see that a little bit of time and a little bit of money spent on prevention, especially with oral hygiene, can go a really long way for creating good patient outcomes. So that brings us back to our question. What can you do with $5 in 5 minutes? Well, the answer is you could save a life. That really is what's at stake here. Some of these prevention services are very basic. We all know how to brush and floss. But if we take just a little bit of time to make sure that our patients are getting that same care, we can create really positive outcomes for them. All right, and that's my presentation. Thank you so much.